Hey you! Exhausted, frustrated pharmacy student? Have you been experiencing excruciating headaches that last a long time? Weakness? Or forgetfulness or confusion, maybe during your ID midterm? Then you may have cerebral vasculitis.
Other possible symptoms of CNS vasculitis include strokes or TIAs, problems with eyesight, seizures, encephalopathy, or sensation abnormalities. If you are experiencing any of these symptoms, talk with your doctor to find out more.
Hi, I'm Dr. McDreamy. Cerebral vasculitis is a condition caused by inflammation in the blood vessels of the brain and the spinal cord. There are two types of cerebral vasculitis: primary meningitis of the CNS and secondary vasculitis due to underlying conditions. It's quite a rare condition. The overall incidence of primary vasculitis is approximately 40 per million.
It is unclear how the vessels in the brain become inflamed. In some cases, abnormal antibodies and white blood cells attack the vessel walls, causing inflammation and destruction of the walls. Infections, especially those caused by a virus, can also cause CNS vasculitis. You may be at an increased risk if you have a systemic vasculitis disorder, or if you abuse drugs such as amphetamines and sympathomimetic agents. Clinical diagnosis is difficult. It is based on a person's medical history, symptoms, complete physical exam, and results of special lab tests. Usually there is an initial MRI to assess degree of blood vessel wall changes or damage. If these results are ambiguous, a digital subtraction angiography is performed. Small vessel vasculitides evade detection by vascular imaging and require a brain or leptomeningeal biopsy. A lumbar puncture may be done to assess the spinal fluid to find cause for the inflammation. In addition, lots of blood work is done to assess abnormalities, but often the blood work is normal in primary meningitis of the CNS. As cerebral vasculitis can present similarly to other diseases, a brain biopsy may be the only way to make certain a diagnosis. So once we have the diagnostic tests back, what are the next steps to take? To learn more, let's go back to Dr. McDreamy.
Treatments for primary CNS vasculitis includes high-dose corticosteroids for prolonged periods of time and sometimes lifetime, and possibly in conjunction with cyclophosphamide.
We have explored a lot of information in regards to cerebral vasculitis, but as pharmacy students, we are always asking the questions. Why does this apply to me? Where will I, as a pharmacist, fit in?
The pharmacist plays an integral role in providing care for a patient with cerebral vasculitis, especially when it comes to ensuring that prescribed medications are indicated, safe, effective, and adhered to by the patient.
Additional roles of the pharmacist include gathering patient information related to allergies, medical history, and medication history, providing information to the patient about medications, especially in regards to adverse effects to watch out for, and being a constant resource for the patient to answer their drug information questions. In summary, cerebral vasculitis is the inflammation of the vessels of the brain and spinal cord. It may be one of two types: primary meningitis of the CNS or secondary vasculitis due to an underlying cause. It is unclear how the vessels of the brain become inflamed. May be due to an autoimmune disease, infection, may be drug abuse. Symptoms may include chronic, severe headaches, confusion, weakness, seizures, and many more. Diagnosis is difficult and complex and involves many tests, but due to the similarity in presentation of other conditions, a brain biopsy may be the only way to make certain a diagnosis. Treatment involves high-dose corticosteroids for prolonged periods of time, as either a monotherapy or in conjunction with the chemotherapy drug cyclophosphamide. Pharmacists play a critical role in providing care for a patient with cerebral vasculitis, always checking indication, safety, efficacy, and adherence of medications prescribed. Thank you for tuning in to learn about cerebral vasculitis. Please see our summary handout for more information. We hope you have a wonderful day.